During the healthcare debate underway in Washington, some Americans have asked, why can't we get the kind of healthcare Congress gets? And some members of Congress have responded that they have the same insurance plan that's available to all federal workers. And that's true, to a point. Our chief medical editor, Dr. Tim Johnson, went down to Washington to get a closer look and see if members of Congress don't get a good bit of extra care.
Hundreds of members of Congress are receiving some of the best health care in the country without ever even using their federal health insurance. And all right in the U.S. Capitol at a little-known and rarely discussed clinic called the Office of the Attending Physician.
They have a very small pharmacy. They have physicians and nurses that will see you on the spot, on the beck and call.
Congressman Steve Kagan, a medical doctor, turned down the health insurance options offered to Congress, but this winter even he used the office.
They also have physical therapy available, which I took advantage of when I had my knee surgery. It's one of the, quote, benefits of being a member of Congress.
How much of a benefit? For a flat $503 yearly fee, members have access to almost all of the primary care they could ever need, from exams and x-rays to minor surgeries. Last year, about half of Congress paid the fee. And sources say if a specialist is needed, one will be brought to the Capitol. All of this for no additional charge.
Cardiologist, pulmonologist, dermatologist, gastroenterologist, rheumatologist, just a wealth of specialists that support the office.
The Office of the Attending Physician does serve a broader public purpose, providing emergency care to anyone on Capitol Hill. But few people know about the first item listed in its mission statement, providing primary care to Congress. We asked repeatedly for an interview or a tour, but were denied. And when we tried to visit, we were asked to leave.
Okay, so let me see what I can find out.
Representative Lee Terry of Nebraska does not use the office.
This thing called the Office of the Attending Physician.
Oh, yes.
Which you smile and say, oh, yes. Why do you do that?
Oh, it's a great asset. Somebody passes out on a tour, it's our attending physicians that are there right then. But there is an option. You could use them as your, in essence, family practitioner while you're here.
Terry is introducing a bill to offer the same type of health insurance options provided to Congress to all Americans.
I'm sitting here thinking, if you're going to introduce this bill for the federal health plan, why not throw in something like this office that is provide primary care? If Congress can have those kinds of things, why can't we?
That's a fair question, and they should have that. Because frankly, having a physician that you can call and contact actually helps drive down the costs.
Good primary care, an ingredient everyone agrees is necessary for true health care reform. Dr. Timothy Johnson, ABC News, Washington.